Choice of fluid. It is important to know the necessity or the type of deficit of a patient to have a proper selection of fluid. It also depends on what type of clinical condition a patient has. So here are the clinical conditions and its choice of fluid and indication. First is isotonic saline, normal saline, 0.9%, which is used to correct metabolic acidosis or high levels of acid in the body. Next is the isotonic dextrose saline, which contains 0.18 sodium chloride and 4.3% dextrose. It is used for maintenance therapy and also for hypertonic dehydration or hypernatremia, which is an imbalance of water and sodium in the body wherein there is an increased level of sodium. Next is the Dextrose solution, which contains 0.4% sodium chloride, 0.27% potassium chloride, and 0.58% sodium lactate. It is used for metabolic acidosis and potassium loss and also for dehydration caused by diarrhea. Next is a 5% dextrose. It is used for hypertonic dehydration resulting from water deprivation or heat stroke. It is also used in emergency to provide temporary solution for hypoglycemia, which is low blood sugar level, and also for vomiting. Next is a compound sodium lactate. It is used for metabolic acidosis and for replacement of losses owing to gastrointestinal dysfunction such as vomiting or diarrhea, and also for hemorrhage and burns. Next is a dextrose saline, which contains 0.9% sodium chloride and 5% dextrose. It is used for dehydration, hypoglycemia, and vomiting. Next is the sodium bicarbonate, which is most commonly used for severe acidosis. Next is the whole blood, or the blood transfusion in treating anemia. Next is the plasma expanders. Example of this is dextran, which is used for the treatment of circulatory shock and hemorrhage. Lastly, the gelatin colloidal solution, which is used for hypovolemic shock, wherein there is severe blood or other fluid loss, burns, and diarrhea.